Bismillahirrahmanirrahim. Assalamu alaikum everyone. Welcome to the stream of knowledge. Today we will discuss about Streptococcus pneumonia. After hearing this terminology, the first question that will come in your mind is, what is this Streptococcus pneumonia? And what we will learn in this lecture? You will learn about its morphology, its important properties, its pathogenesis, or the way it causes disease, its signs and symptoms, its lab findings, and its treatment. So let's start. What is Streptococcus pneumonia? The word strapped mean the bacteria grows in chain, and coccus is the cocci or round-shaped bacteria. Streptococcus is the round bacteria that grows in chains. Why pneumonia? Because strep pneumonia most commonly cause community-acquired pneumonia, and hence the Streptococcus pneumonia the round-shaped bacteria that grows or lives in chains that most commonly cause community-acquired pneumonia is called strep pneumonia. One more point you must remember in your life is that there are two cocci, Staphylococcus and Streptococcus, that are gram-positive. You must remember that. So, after hearing the word Streptococcus, the 2 points that must come in your mind is that Streptococcus is a gram-positive and it is strapped, it grows in chains. So, strep pneumonia is gram-positive bacteria and it grows in chains. But one is the differentiating feature between Streptococcus pneumonia and other species of Streptococcus is that strep pneumonia is diplococci. What? Diplococci. As you can see in this picture, the bacteria has been arranged in pairs. As we know, di mean two, and as you can see, di mean two, cocci mean two cocci. These are two cocci. And one another name is for that is lancet-shaped diplococci. Really? Lancet shape? The word lancet means oval. As you can see here, the bacteria is oval shape. The two oval shaped bacteria are here. The oval shaped bacteria that are arranged in pairs are called lancet shaped diplococci. So, what is the morphology of strep pneumonia? Strep pneumonia morphology is lancet shape. As you can see here, oval shaped bacteria that are arranged in pairs is called diplococci lancet shape. They're also arranged in small chains, but mostly are diplococci, as you can see here. That was all about its morphology. So, what are the important properties of strep pneumonia? Oh, they are so funny. They show alpha hemolysis on blood agar. What alpha hemolysis? We already studied about beta hemolysis, gamma hemolysis, but what is this alpha hemolysis? Remember one thing in your life that beta hemolysis is the complete hemolysis, gamma hemolysis is no hemolysis at all, while alpha hemolysis is the incomplete or partial hemolysis. We know beta hemolysis is due to hemolysins, as we also know that in blood agar there is blood. You must think that, oh, what kind of hemolysis we are discussing about. Remember, it's the blood agar and it contains blood, so it's hemolysis of blood or RBCs, okay? And alpha hemolysis is the incomplete hemolysis of this blood or RBCs. But why incomplete? Because Streptococcus pneumonia contain pneumolysin. This pneumolysin breaks down the hemoglobin to biliverdin. And we know biliverdin is green in color. As you can see here, this is green in color, and hence all the strep pneumonia shows alpha hemolysis or green in color or green color on blood agar. Another property is that it is lysed by bile or it is bile soluble. As you can see here that this tube is has strep pneumonia and it contains bile and the strep pneumonia has been soluble. While here the turbidity you can see there is another species of streptococcus which is not soluble in bile. So bile solubility is another differentiating feature for strep pneumonia. It is also optogen sensitivity. But what it does mean? Optogen sensitivity means the antibiotic optogen cause inhibition or killing of strep pneumonia. It also contains polysaccharide capsule. This capsule has virulence, but we will discuss in pathogenesis. But here it is used for the identification of bacteria strep pneumonia. But how? With the help of quelling reaction. Quelling reaction? Remember, the capsule is made up of polysaccharide, and polysaccharide is a sugar. So the sugar components of this capsule vary from species to species of strep pneumonia. There are 91 serological types of strep pneumonia, and hence 91 types of capsule. And hence each capsule has specific antibody. If this homologous antibody binds to this capsule, the capsule will swell, and this is called quelling reaction. With the help of specific antibody, we can identify the specific kind, the specific strain or specific species of that strep pneumonia. It also contains C substance or C polysaccharide in its cell wall. What is this C substance? This C substance is actually the teichoic acid. Teichoic acid, really? This teichoic acid is medically important but not for itself. Remember, this teichoic acid react with the CRP protein or C-reactive protein. Do you remember the CRP protein increase in inflammation? Acute inflammation is used as a marker. Hence, this C substance is used for the measuring of CRP in labs. One more important point about strep pneumonia is that it contains IgA protease. Why? What? IgA protease? IgA protease is a protease that breaks down the IgA antibody that we will discuss in pathogenesis. Strep pneumonia is the normal flora of oropharynx. But how it can cause disease? Let's learn about its pathogenicity. Pathogenesis means the way it causes or the strep pneumonia cause disease is called pathogenesis. Number one, it contains virulence factor. The number one virulence factor is the capsular polysaccharide. Remember, this polysaccharide capsule has negative charge. Okay, negative charge. So what? Neutrophils also contain negative charge. Oh, really? Whenever this neutrophil come to engulf this bad bacteria, the negative charge on that bacteria will repel the negative charge on neutrophil, and hence antiphagocytic activity will occur. And increased virulence mean increase the ability of bacteria to cause disease. Oh, it also contains lipoic acid. This teichoic acid also play a role in pathogenesis. But how? Remember, this teichoic acid activates the complement system, and this complement pathway will cause increased production of cytokines, and this increased production of cytokines will cause septic shock. The body will enter in shock. But mostly, this lipoic acid cause disease or act as a virulence factor in immunocompromised patients, mean in those patients that have weak immunity. Strep pneumonia also contain pneumolysine. As we have discussed, it causes alpha hemolysis, but how it have pathogenic role? This pneumolysine actually causes pores in the cell wall of human cells. It also causes help in the bacteria in colonization, and it also help the bacteria in invading the immune system. Oh, really? Now the very important IgA protease. As we know that our mucosa of respiratory tract and GI tract, etc., has been lined with IgA antibody. This IgA antibody protects us from bad bacteria or bad microbes. But as this is IgA protease, protease means the protein breaking, and we know antibody are somewhat proteins. They contain amino acids, so these are protein, and hence the IgA antibody will break down. If there is no antibody, so what will happen? The bacteria will colonize here. Oh, it will multiply, and then it will cause inflammation there, and infection will occur. Many infection that we will discuss in its clinical findings. But if this bacteria enter the alveoli, it will be dangerous. Now, what will happen in alveoli? In alveoli sac, the fluid will be porching here, WBC, then RPCs, and condensation of lungs occur. What is this consolidation? This consolidation means the hardening of right why the pointer is not moving. Ugh. This consolidation means the hardening of soft tissue of lung or alveoli will be hardened, and it can be seen in radiology. But this consolidation will be recovered if the pneumonia is engulfed by phagocytized, and mononuclear cells will engulf this hardening, and our lungs will be recovered. That was all about pathogenesis. Now let's learn about its clinical findings or sign or symptoms. The number one disease it causes, as its name indicates, is the pneumonia. Remember, the typical symptoms of pneumonia are the sudden chill, fever, cough, and pleuritic pain. These are the atypical symptoms of pneumonia. What is pleuritic pain? Pleuritic pain is the sharp pain in the chest, sharp and sudden pain in the chest. But you can identify the patient of pneumonia as with fever, cough, chill, sweating, loss of appetite, nausea, vomiting, and sharp rise in temperature mean fever, chest pain, which is pleuritic pain, severe weakness, flushing, skin, body itches, labor breathing. This is pneumonia scenario. But it also causes and the other symptoms. Very important point. The patient pneumonia patient have sputum with red or browny rusty. Whenever someone asks you what are the symptoms of strep pneumonia, which kind of diseases strep pneumonia cause, you must remember the four diseases. Number one is pneumonia, number two is bacteremia, number three is meningitis, and number four is infection of upper respiratory tract. Infection of upper respiratory tract because it causes IgA protease, which break down the IgA antibody and cause infection there. What kind of infection it will cause? It causes otis media. What is this otis media? Remember, otis media is the inflammation of middle layer. It causes mastoiditis, as the mastoid is a pain is a bone, sorry, is a bone behind our ear, and as you can see, inflammation of that bone, infection here occur, and the swollen area, as you can see here, this is mastoiditis. It also causes sinusitis, as you can see here. This is sinusitis, the inflammation of sinuses and the fluid here. It is caused by strep pneumonia. It also causes conjunctivitis, mean the inflammation of conjunctivas of eyes. It also causes pericarditis. What is pericarditis? I hope you remember that pericardium is the layer, is the layer of heart. So the this pericardium inflammation is called pericarditis. Strep pneumonia also causes sepsis in the patient. One very important point in the pathogenicity of strep pneumonia is that it mostly causes disease in immunocompromised patients, mean they whom they have weak immunity. Okay. One of the important disease caused by strep pneumonia is the meningitis, means the inflammation of the meninges, as you can see here. Now, how we can diagnose the strep pneumonia? We discussed all about in its important properties. If you remember this is you will crack in just a minute. Okay, whenever a sample will come in a lab, it can be a CSF or blood or whatever sample come, you have to culture it, as you have to, first of all you will culture it on the blood agar plate, and if you notice the alpha hemolysis there, okay, go for, you have to go after culturing, you perform is staining, it's catalase test. If it is gram staining, if you go for it, and if it is gram positive, you have learned it, if it's gram positive, and remember it strapped all the straps which are catalase negative, coagulase negative. So it must be catalase, if it is catalase negative, gram positive, and we remember also that it is optogen positive, optogen sensitive, and bile solubility, also it must be soluble in bile, and quelling reaction can also be done for that. It must if it show the swollen capsule by homogeneous antibody, it must be homogeneous antibody to strep pneumonia, it must be strep pneumonia, and you can also identify its strain. The overall that the lancet shape gram positive diplococci are in gram staining, you will notice them, and alpha hemolysis on blood agar, bile positivity, and optogen inhibition or optogen sensitivity, and quelling reaction. All these tests are done. Whenever a rapid test also done, but these are the tests that are performed. If all these tests are positive and you show their special characteristics, so it will be strep pneumonia. pneumonia, and it can be treated with strep pneumonia can be treated with the antibiotics, for example penicillin and erythromycin. Oh, that was all about strep pneumonia. Thank you for watching. If you really learn something in that lecture, so do subscribe, like, comment, and share. Oh my god, I'm so freaked out now. Goodbye, I love you.